Hi there everyone, my name's Alexa. I'm a hip dysplasia patient. I had my left periacetabular osteotomy done about 5 months ago now. I also happen to be a running coach and a sports massage therapist, and I thought I'd share a few things that I actually found really quite useful about particularly my sports massage training when it came to understanding more about preparing for and then the recovery from my PAO. I think the biggest thing was about anatomy. So having a little bit of knowledge about the different muscles, particularly around the hip area, what their names are, some of the names of the bones, can help with your own kind of knowledge, I think, and control of the situation when you get a diagnosis and approaching an operation as big as a periacetabular osteotomy or a triple pelvic osteotomy or similar. But also helps demystify some of the language used by our medical professionals, so consultants, specialists, doctors, physiotherapists. So I thought I'd talk you through a couple of sort of useful ways that I found to kind of learn that anatomy in a simple way. I'm quite a visual learner, so that really helped, hence the poster up on my treatment wall, because I find I often begin and end my treatment sessions with explaining to people a little bit about their body, and that often really helps them to understand a little bit more about what's going on for them. So these posters themselves are brilliant. You might have seen them in a sort of doctor or physical therapist or physiotherapist's office. But I find particularly this book is wonderful. The Trail Guide to the Body. It's a little bit pricey because I think quite a lot of people use it for study. But what it does is literally talks you through how to feel your way around all sorts of different muscles. So let me take you to the leg section, which is somewhere in the middle. And what it'll do is let you kind of feel your way around, like a guided tour of different muscles. So it will give you lots of brilliant drawings of where different muscles are and what's being used, for example, as you take a step up a stair. But it'll also allow you, it's helpful to work with somebody else for the bits that you can't easily reach, but it'll teach you how to feel different sort of marker points, bony marker points on your own body, and then teach you how to feel your way through your muscles. And I find that a really useful way of learning, and it might be useful for you just to understand a little bit more about your body, maybe even distinguish, oh, actually that's a muscle I'm feeling there, it's the muscle that's sore, not necessarily the bone or the joint perhaps on that occasion. The other thing that I found really useful, again from an anatomy point of view, is the anatomy colouring book. It covers pretty much all of the body, so you don't need necessarily all of it if you're just wanting to get to know your muscles and your bones. But again, for people that are quite visual, I found it a really useful kind of thing to do. It might also be useful post-op. Colouring is supposed to be quite therapeutic. I'm quite bad at colouring, so I actually find it annoyingly frustrating because I can't colour in very well. But the colouring book might be a nice thing to kind of look at again, just to learn the anatomy, get to know your own body a little bit to help with your recovery. 3 other books that I found really useful while we're on the topic of books, not necessarily anatomy related. This one, oh my goodness, this one is an absolute godsend. Lots of useful information from 2 medical professionals that also happen to have had hip dysplasia. Loads of patient stories to show you exactly how varied and different our experiences can be of dysplasia and the various different treatment options available. All sorts of useful stuff like what to pack in your hospital bag, what to expect when you're in hospital, kind of sneak tips from patients. It's really nice, it's written very clearly and as a literal Bible. It also, very helpfully, has a section in there for carers, for people that are looking after you, which I found particularly useful, just giving family members and friends a bit of a kind of heads up about what they might be letting themselves in for when I was going through the surgery. This one I don't think necessarily you can always heal your hips and prevent hip surgery with water-based exercises, but it has been a really good guide for me of what to do pre and some ideas for post-op in the pool. I end up doing a lot of my exercises in the pool still post-operatively, and was doing quite a lot of stuff in the pool beforehand. It's really, really nice, gentle way to build up strength without necessarily putting all the loading through your hips. And your hips, if you're approaching or have just gone through surgery, probably not a great fan of huge amounts of loading. So water-based exercises can be good. And this is a bit of a taboo topic. It's something I was wondering about. I didn't pluck up the courage to ask my physio or my consultant. Sex with dodgy hips doesn't just cover dysplasia, but dysplasia is included. It was written by a lady who's suffered from hip dysplasia and has had 2 osteotomies to help with that. So all sorts of different tips, again, from talking to your partner, different positions that are sort of safer, you know, different things to bear in mind, the effect on relationships, which I think is a big one that perhaps we don't talk about enough. So those have been some useful kind of things that have helped me a little bit through my hip dysplasia journey. The anatomy side of things has really helped. So hopefully with a few ideas about the books there will help you on your journey too.